Hi, I'm Dr. Catherine Bowling, practicing family medicine physician in Baltimore, Maryland, and today I'd like to talk to you about stroke. And the reason I want to talk to you about stroke today is in my practice lately, I've had 3 people call me with symptoms that sounded like they could be having a stroke. And with each one, I recommended they go to the hospital. And 3 times, those patients were reluctant to go, and they just didn't think it was that important. With my first patient, that patient ended up going to the hospital by ambulance later when the stroke progressed, which was a terrible shame. And 2 other patients I was able to convince to go to the hospital. Both of them were having a stroke. So what do you do if you think you might be having a stroke or you just suspect it? You're not 100% sure. Maybe all of a sudden you have some numbness in your face, your arm's a little weak, but you don't want to run off and go to the hospital if you don't have to. Well, I'm here to tell you that if you think it's possible you might be having a stroke, your best bet is to go immediately to the emergency room. Your second best bet is to call your doctor and talk to them immediately, and they will probably tell you to go immediately to the emergency room. Because you have a limited period of time when you have a stroke in which you might be able to get treatment. You only have a few hours from the onset of your symptoms to get clot-busting medicine. And the reason you can't get it after that few-hour window is because there's risk that you could bleed into your brain if you wait too long. And so they won't give it to you. So really, it's better to be safe. Go to the hospital. Tell them you think you're having a stroke. They'll get you back right away, and they'll scan your brain to see what's going on. And if you have some neurologic deficit, like you can't move your arm, or even your arm's moving on its own and you're not doing it, sometimes that even happens, they can give you medicine to stop the progression of the stroke and perhaps make your symptoms go away. But they can only do that if you react quickly and go to the hospital. It's better to go and have them tell you, no, it's not a stroke, you're okay. Go ahead and go home. So you wasted a few hours at the most, and it cost you a little bit of money. But if you don't go and you're really having a stroke, it could cost you your mobility, your independence, your ability to communicate. So if you think something's wrong, you can't speak properly, things sound garbled to you, you have numbness or weakness on one side of your body, go to the hospital immediately and get evaluated for a stroke. It could change the quality of your life and save your life as well. Thank you for listening. I'm Dr. Catherine Bowling, practicing in Baltimore, Maryland for a healthier, happier you.